What should be done if anesthesia fails during surgery? This man had already been injected with anesthetic. He should have been fast asleep, but when iodine was rubbed on his skin, he could clearly feel the coolness. He couldn't move his body or speak. The nurse covered his eyes, inserted a tube into his mouth, and then covered him with a cloth. This meant that the doctor was about to start the operation. This unfortunate man was named Tom. He suffered from severe heart disease and needed a heart transplant to survive. Unfortunately, Tom had an extremely rare blood type, making it difficult to find a matching heart. His mother had already scheduled an appointment with a world-renowned expert who would perform the surgery immediately once a heart was found. But Tom had his own ideas. He wanted his friend Jack to perform the surgery because Jack was also a surgeon. Despite having been involved in 4 medical accidents, Tom still trusted him. But no matter how his mother tried to dissuade him, Tom insisted on having Jack perform the surgery. However, he did not know that this surgery was a terrible conspiracy. During the surgery, he suddenly sat up, he pulled out the tube, and got off the operating table. But when he turned his head, he found himself still lying on the operating table. Although his body couldn't move, his mind was clear. However, the doctor didn't notice anything unusual. He picked up the scalpel and began the surgery. Only Tom knew how much it hurt. He desperately tried to control his body, even if it was just to move a finger, but he was powerless. To alleviate the pain, Tom began to recall the sweet moments he shared with his beloved wife Anna. This was the only thing that could sustain him. The anesthesiologist, seeing that the surgery was proceeding smoothly, went out to rest. However, as soon as he left, the lead surgeon Jack immediately became agitated. From the conversation between him and his 2 assistants, Tom learned a shocking truth.